The eye's bony socket is a fixed space. When muscles behind the eyeball become inflamed and swell, there's nowhere for extra volume to go. The eyeball is forced forward. This swelling persists whether your thyroid hormone levels are high, low, or completely normal. To catch this condition early, we need to map how physical changes appear on the surface. We're going to walk through a step-by-step self-assessment guide to track the symptoms. By recognizing the specific mechanics of the swelling, you can intervene during the early aesthetic changes, long before the internal pressure causes permanent structural damage. Our first sign is lid retraction. The white exposed above the iris creates a staring appearance. The upper eyelid muscles become stiff and cannot stretch to close. Tears evaporate rapidly, causing dryness. As the rigid lid scrapes the surface, a red friction spot forms. Managing this stage requires substituting the lost moisture. Over-the-counter lubricating drops replace the tear film, while a doctor might prescribe targeted steroid drops to calm localized friction spots. These surface-level irritations act as your early mechanical warning system. Daily management here stops the friction cycle before deeper tissue inflammation takes hold. The problem progresses as inflammatory fluid fills the eyelid and surrounding tissues, causing the outer eyelids to visibly swell. If you look up, down, or side to side, this physical motion stretches those already inflamed muscles, triggering a specific, dull aching pain behind the eye. Deep tissue swelling requires a stronger medical response. At this stage, doctors typically rely on oral steroids to actively suppress the inflammation throughout the socket. This comparison shows a healthy eye on the left and early bulging on the right. Check your symptoms. Look in a mirror or compare a recent photo to an older one to spot any new white space above your iris. Then, actively move your eyes up and down to test for any dull, aching pain. That specific pain, triggered by physical movement, separates the mechanical strain of thyroid eye disease from generic seasonal allergies or screen fatigue. In roughly 6% of cases, deep swelling physically pinches the optic nerve, causing optic neuropathy. As this compression blocks nerve signals, the immediate warning signs are a sudden drop in overall vision or a distinct fading of how you perceive colors. This compression requires immediate surgical resolution. A procedure called orbital decompression removes a small amount of bone to create more physical space in the socket and relieve the pressure on the nerve. This TED action matrix outlines care. Phase 1, staring and dryness require daily lubricating drops. Phase 2, friction spots, swelling, or pain means consulting a specialist for steroids. The final phase, vision loss or color fading, is an emergency requiring immediate decompression surgery. By tracking your physical symptoms against this exact matrix, especially if you are over 40, you can intercept the swelling while it is still a surface irritation and protect your vision before the damage becomes permanent.